He has kind of obliged to spend the next hour with us today, talking about certain special precautions that we will have to take for children during this pandemic. We are extremely grateful, Doctor, to you for taking time amidst this very busy schedule that I'm sure all medical professionals are going through. A few quick notes to all the participants. Please feel free to ask as many questions as you might on this topic. Use the box for asking Q&A to the panelists, and we will relay it back to the doctor as and when it's the right time. We will be recording this session so that it's available for all the ones who are not able to attend. So I hope all of us are okay with that. And with that note, I will hand it over to Doctor and Simon. I hope you're there.
Just 1 second. I want to share the PPT because Doctor want to share the PPT.
Sure. We can see a deck, Simon. Yeah.
Sure. I'll just try to share my PPT.
Yeah.
Okay.
Is this visible?
Yes, Doctor.
Is that clear? Okay, fantastic. So, thank you very much for your kind introduction. And without further ado, I'll just start. I think we all know that we have been going through a lot of issues because of the lockdown, and not just the lockdown, but what are the precautions that we should take, especially for children. And I'm just singling out children here only because so far COVID has been very kind to all our children. And just a word of caution, it may not be in the near future. So I'll just come to that in a bit. And there's, as you said, Dr. Pratap Chandra, I'm one of the neonatal consultant lead for motherhood hospitals. So I'll just go through this presentation. It won't be interactive because of various issues. And at the end of it, I think I'm very happy to take any sort of questions that you have. So basically, I would like to talk to you about how some of the tips to keep the children engaged. What are some of the problems that you might, encounter during these lockdown and the challenges, and how do actually children behave differently during this period, and some of the tips to, how to overcome these sort of issues. A little small tip about infection, how to deal with it, and also the vaccination. So, lockdown, I think this has been the scene for the last 1 year, one and a half years, and it has been really up and down with us, and we don't know how long this lockdown is going to continue. It's very important from the government perspective that the lockdown should happen. The reason being, it's completely overwhelmed. The whole entire healthcare system is on the verge of collapse. So that's the number of patients that we are getting, and the number of people that are getting affected. So and a lot of our near and dear ones being lost during this time. So I understand your problems. You'll be presenting pitches from your sofa to a person who is sitting somewhere remote, and then a lot of you will be collaborating on the teams remotely, and then discussing various aspects of the business management and whatnot. And then there are a lot of women I know that they just bring their laptop onto the breakfast table, and they have to multitask. So we all realize that at the end of the day, you are all working still from home. We all know that. I'm a little lucky in that sense. I've come out of the house every single day. Otherwise, I understand what's going on in your minds. It's not easy to be locked down. So everybody needs their freedom. Everybody wants to just come out and enjoy that sunshine and all that stuff. So it is very difficult. For some of you, you would have always done this at home. For some people, it is a major adjustment that they'll have to do in. Sorry. And when I want to add kids into the mix of all this, it brings its own challenges, it brings its own complexities. Because for children, you are at home is like honey for them. Basically, they think that they can play all day, and I'm sure a lot of them would have gotten used to the fact that you cannot play with them all day. But still, the smaller ones, especially less than 5 year olds, they tend to still be very clingy, and they don't understand that their parents are working. They're not able to understand the fact that why is it that my parents are not playing with me. So it does brings its own challenges. And as I said, a lot of you would be multitasking, and if there is no requirement of a video calls for you guys, so most of you would be sitting in the pajamas also. So it's just that the mindset, the change in the mindset should happen to all of you. So that brings in a lot of complexities. So how do we deal with this with our kids? You please explain to them. You have to talk to them. Any child nowadays above 3 years, I feel like they talk like Obama. So basically, they feel like they know everything. So if you sit with them and then talk to them, explain to them that this is like we are forced to be indoors. The reason is of the infection, and then how it is so deadly, and then how it can actually ruin the lives of the people. And therefore, once they understand that there is an importance that is given to them, the importance is a challenge that they have to stay indoors. Then majority of the children will exhibit that sort of a willingness to comply to whatever you say. Instead, if you keep saying stay indoor, don't go out, stay indoor, they will not able to understand. So you need to change the way that you talk to your kids. So most importantly, keep talking to them, because imagine they should be really free like birds. They should be just going out and playing. And don't forget it, they didn't have school for last 1 year. And imagine their school holiday, which was supposed to be between April to May, June, that is also ruined because of all this. So they're not able to understand. They would have made a lot of preparation to play with their friends, the playmates. A lot of them would imagine sleepovers in their friends' houses, swimming lessons, you name it. They would have also built everything, because schools, although it was closed, the online lessons were going on, especially for slightly older children. And it was a nightmare. I also experienced the same thing in my family as well, as I've got a son who's 11 years and a daughter who is about 7 to 8 years. So it is not easy, right? Some of the things we did, because we had to work, and we had to come out of the house every single day, be it day or night, be it Sunday or a bank holiday or a festival. We have to work. So therefore, what we did was set up a routine. So not just for the kids, but for the parents as well. Say, for example, that you're not going outside to work. That doesn't stop you from taking the shower at the right time. That doesn't stop you from putting on the clothes. So that gives that children also, oh, okay, yeah, dad is doing this, mom is doing this. I think they're going to go sit in their office and then start doing the work. So it gives them that sense of preparedness as well for the routine. Always have fixed meal time and the bedtime. This is extremely important, because if you try to falter away from this, then obviously that sort of a discipline will be lost. I know it's not easy, but I'm just trying to give you some tips where you can help yourselves with this. Online sessions already started last year itself, and that might this year also looks like most likely it's going to continue this online sessions. So I guess children are really bored, but then if it starts, then at least you have that time not to sit with your child. I'm talking mainly about 6-7 years plus children. Less than that, obviously, they need help. They cannot sit in front of the computer and then keep staring at the teacher and listen and learn about everything that they say. It is hard for children. Set a timetable of different activities, like morning, go for a walk, cycling, whatever that you feel like you want to do. Then your routine should be shower, breakfast, and all those things should follow a little pattern. Then I think whether it can be an online guitar class, Carnatic music class, whatever you feel like, you need to have that sort of different activities to keep yourselves engaged. Don't just be a victim of monotony. Okay, and give children some meaningful chores. Let them learn. This is a great opportunity for them to learn, especially small things like making their own beds, cleaning their rooms, tidying up whatever that they have left the rubbish after playing. Just empower them. And the more and more you start believing them, the more and more confident they will become. Maybe you have to teach them few days, but then we have got a lot of time on hand. Right? So this is exactly what this picture depicts. So you can actually involve them in your cleaning process, in your household chores. Yesterday I did cooking with my children. Good. I don't think they will be of great help, but get me this, get me that, put it in the dishwasher, go bring the plates, get the water, chop some onions. These are small things that they can get involved as well. And our biggest enemy, I think, this decade onwards, last decade, this decade has faced is gadgets. Gadgets are friendly because that can at least engage your child in that way, but it's one of the worst of the enemies. I feel in the kids' world, it's as good as tobacco, smoking, right? There is a huge issue that there is possibility that they might be stuck onto the screen for longer time than that is needed. And I would suggest you to give age-appropriate quota. What I mean by this is less than 2 years. Now the screen time is absolutely zero. Okay, I've been seeing in my clinic every single day at least 3 to 4 children coming up with sleeplessness and inability to sleep, because it's like all your gadget games, PS4s and all that. It is about killing. It's high thrilling games that they do, and that gives them the adrenaline rush and secretes dopamine in their brain. And dopamine is the hormone which gives you that sort of a feel good factor. That is the reason why they get addicted to it, right? Even alcohol is similar. It gives you that oomph in the brain. That is why people get addicted to alcohol as well, right? So it is very similar to that in children. So try and see whether you can give age-appropriate quota. Otherwise, with a lot of behavioral problems, they have absolutely no attention to detail. So attention deficit, therefore hyperactivity, ADHD disorders are becoming more and more common. A lot of our children are becoming quite introvert, and they cannot express themselves. And the danger of this is upper limit of this would be autism, autistic spectrum disorder. I'm not scaring you. These are all facts. So I think it is better for us to use media strategically to get through the days and nights. And also for the adults, don't keep putting on that public TV, NDTV, this, that, news all day in and out. In some houses, it doesn't even switch off. And what are they saying? Complete negativity. And one party is pulling down the other party's leg. There's no one who's trying to help out there. They're trying to create more panic out there. So I would say bring in more positivity. You want to use media strategically, use it. Obviously, there is a risk also in watching movies like Radhe. I need not say more, right? And try and see whether you can make it more productive. Like, you have these Zumba classes online, you have these cult classes online. You can use them for children. I don't know what they're going to do after learning coding, but this has become a new sensation now. Everybody wants to do coding. I'm not sure how many Bill Gates we are going to prepare. So Byju's, I found it very interesting, very interacting. They're expensive, but then these are some of the ways that if your children wants to use gadgets, use it in a much more productive way, right? So otherwise, we are seeing a lot of children with headaches, needing glasses at very early stages, and failing to interact with people, sleeplessness and restless behavior. All this is linked to the gadgets. So be very careful. I've not even touched upon the radiation effect of the gadgets, so let's not go there. So very good time for you guys to nurture a hobby. It can be online guitar class, somebody wants to learn the piano, it could be that. as well. So we cannot just say that education is only given at schools, and we cannot say that the lessons that we learn at school are the only education. I think that is most rubbish of all the education that we learn. As we keep going along, nobody would remember what they have learned in the school or the colleges, and the practicality of it. A lot of people who do nowadays, engineering or even doctor, they become managers. Okay, so a lot of people do the change in the field, and majority of you who are successful, you realize that you need more of interpersonal skills. You need more of skills to work in a team. You need, more of problem-solving nature, and you need to come out of those kind of a set box of school, and school only can teach education, right? So you can do painting, drawing, storytelling. You'll be amazed the kind of the talent these kids have got. And I don't have any issue at all. Give them a corner, let them mess about everything. So that keeps them motivated, and obviously after that they need to clean, right? So that gives them the activity for them to be engaged, and then they keep doing all these things. As I said, use digital media for exercises, like how this mommy is doing multitasking, and also her planks with two kids on top of her. Okay, so there are a lot of things that you can do staying at home. The last thing that you want to do is staring at that the idiotic box, which is our television, where a lot of rubbish is thrown at us. Instead of that, use it in a much more positive way, and make sure that during this lockdown, see whether you can learn something new which you've never done it. This is a great opportunity for you guys to do that. Then, important to be socially connected. Look after your family, look after your elderly people. They are the ones who are very prone. Make sure that you all get vaccinated, please. There are a lot of rumors out there. That's why I hate this media, which is propagating a lot of false news. If there is a vaccine, take the vaccine. I've not seen anyone dying with it. I have taken 2 doses of vaccine. So try and minimize the burden to the healthcare system, which is already crippled, right? So stay socially connected with your family. Make sure they're all safe. Imagine your good old parents. They're just, if they're not staying with you, or even if they're staying with you, they are also depressed. Everybody is depressed. We don't want this circumstance to happen anytime in future for any one of us, because these are very, very horrible times, and none of us would have envisaged any of these at this kind of a scale. On top of it, if near and dear ones are dying, then that adds to the complexity of the things. So try and see whether you can, how much ever it is possible, stay safe. So when I say stay safe, children, COVID has been very kind to them, but we know that the third wave, which is probably predicted by September, October times, because they're not going to be, those are the age group where they're not vaccinated. Therefore, we expect a lot more children to become unwell during this third phase. So please make sure your kids are safe, and teach them all your social distancing, wearing the mask, especially above 5 years of age. 2 to 5, do it when they're only coming in contact with somebody. Less than 2 years, don't use the mask. Teach them how to take care of the hand hygiene, and generally teach them how to be healthy with healthy habits and all that. So moving on further, some of the things that might help you in this lockdown is your relationship that you're going to build with your kids. Okay, for in that you need to understand this family dynamics. So what I would say always is, a child who's born, and a baby is born, already is a person. They should know and have a sense of identity. You need to instill that sense of identity into them. They need to know who they are. If you don't give that sort of an importance to that person, then their brain growth is hampered. Also, their sense of purpose, their sense of belonging to a community, to the state, to the country as a whole. What is their purpose? Is there any role that they can play? You need to imbibe all these activities or all these thoughts into their mindset from as early as possible. And I would say always be positive. Negative, instead it can ruin us, ruin our confidence completely. So try and instill a sense of identity, a sense of purpose, and a sense of belonging to your child. So keeping your child in the middle of it, this would need good parenting qualities. So there are a lot of things that we need to learn. Don't just snap at your children all the time. Don't just keep blaming them. Where else can they go? They also have got four walls to play around, and they're also bored, from morning till night staying at home. Some children are okay with it, but majority are not okay with it. And this sort of things comes from a lot of behavioral coaching. Don't, again, stop from disciplining. You have to discipline your children. At the end of the day, what I meant here by emotional coaching is that they need to have that feel. They need to have that sense that, they belong and they have a purpose. And if they are staying indoors, that means they are responsible. They are behaving in a very responsible way. You need to teach that to your child. And more likely, if you do that, there will be a success that your child is going to understand much better. If we don't do this, obviously, that will end up in your children having quite a lot of tantrums, poor behavior, because their energy is abundant. You're going to just bundle it and then close it. It's not going to happen, right? So they start creating a lot of emotional dramas at the end of it. So this tends to boil from ineffective parenting. I'm not suggesting anyone that you don't have skills or whatever. It is just that these are stressful times. So we need to reiterate ourselves. At the same time, we need to reflect whatever we are doing is in the good interest of your child or not. If you do this very well, then there is a very good family harmony that exists, and then you pass this dark stage without having much of an issue. And sometimes this even calls for a personal transformation, which means if you have a very snappy behavior, if you're very, very aggressive, if you're very easily stressed, like a type A kind of a personality, you need to mellow down. You need to mellow down. Imagine other people have to live with you in the same house. So it's not just for you all the time. It is for other person as well. For that person's sake, we may have to do that sort of a personal transformation. So I go home, I help in cooking, I help in cleaning, I help in everything. Maid is not allowed, and we are not there from 9 o'clock to 7, 8 o'clock in the night. So we have to do all the household chores after going home or before coming to work. So that takes a lot of personal transformation, and we are absolutely stressed. No words can explain that, right? So all you can do now is take care of your family as a single unit. Give that child that sort of a nurturing so that the burden to the healthcare system is reduced, right? So moving on, how do you achieve this? We keep talking about all this, be positive and all that, but how do you achieve it? So this is from the Stanford University, and they're very good in parenting and disciplinary philosophy with a lot of research behind them. So what do they suggest? They say first and foremost thing is the mutual respect. If you don't respect your child, don't expect any respect back. That is very, very obvious. You have to respect your child, whether the child is a 1-year-old or a 14 or a 16-year-old. It doesn't matter. Okay? Don't demand something which you are not able to give. So please start doing that, and you will see immense change in your kids' behavior. And always try and see whether you can give some positive instruction, like don't do this, don't do that. Instead of that, you tell them, if you do it in this way, it's much better. So just change the narrative in the way that you would like to talk to your children, right? Moving along, we need to focus on the reasons behind their action. Yeah? So children come and they start having tantrums, behavioral issues. Why? Majority of the time, they want to seek your attention. That's it. They feel like parents are mine. My mother and father is mine. That's sort of a very strong attitude that they have, which is inbuilt for them. Nobody has given it. It's inbuilt. And then they feel that, that if you're not giving that focus, the attention, they want to bring that focus back to them. And the best way that they know to do it is by throwing tantrums and having irrational behavior. So at that time, what do? You be kind. You understand what they're trying to come from. But at the end of the day, if you really are working from home and if you have to be concentrating, you have to do firm disciplining. A no is a no. A father is saying no, mother comes from back and then she gives some sweets and say it's all right. That doesn't work. Both of you should be working in partnership. Otherwise, kids are very, very, intelligent nowadays, especially, and they will take you on for a very long ride. Okay, just be very careful with children, right? And sometimes whatever you do, it's beyond your control. You're arguing with your children. They're not listening to you at all, but you're getting frustrated and you're getting really stressful. Take time out yourself. Just go to your balcony. Just go outside a little bit and just make yourself a cup of tea. Just spend that time for yourself for 10 minutes. You'll calm down. At the same time, your children will be thinking 100 times. They will be thinking, what the hell have I done? Why is my mother doing this? Why is she not talking to me? Why is she ignoring me? This sort of, hundreds of things going on in their mind. Then when you come back, it becomes much easier to reason out. So these are some of the ways of doing it. Be non-punitive, no punishments. Don't keep giving punishments. Some sort of punishments are okay, but always try and see whether you can be more creative in the way that you say. Like, for example, your TV time or the screen time is only half an hour today, right? Why should I follow as a child? Say, no, I don't want to. I will take another 10 minutes, another 10 minutes. Give them the goal and give them the time for themselves. They are also playing with other children or anything else. They're on their own. It's very stressful for kids as well. They don't know what to do, basically. So then what happens? You tell them to be more creative. So you put a chart and then say, all right, if you've done this really well, then that's a star. Okay, star always works up to 10, 12 years, because star, if you just put it with a purpose, that will be always great. Because what happens at the end of the day is they need to know what happens if I get 10 stars. So you need to set that sort of a goal. Initially, the goal should be at a very small thing. Don't wait for 20 stars. They will never achieve. They know that this is not possible. Let them go to dogs, is what they think. Give them like three stars. If you get, you're in for a reward. That reward need not be very expensive. That reward may be just that half an hour I will give you my attention if you do this. So that's sort of a creative thing. I'm sure you're all more creative than what I am. So you should be thinking about it. So give yourself 10, 15 minutes time every day to think about your child, how you should nurture them every single day. What are the activities that can be given to them? If you are creative, your child will end up becoming more creative, right? And whatever you do, consistency is the key. One day you do it, the next day you yourself are in front of the TV watching that periodic NDTV people and the public TV. Then what do you think? You cannot expect anything back from your child. Your child will say, you are watching it, I'm no different, right? You got to be consistent. Again, when you are giving these instructions, keep in mind, understand the development of the brain of your child. You cannot be punishing a 3-year-old. They will never know what to do. They will not even know why you are punishing. So be also understanding of the brain development of the child. Say here, you can only laugh at it, but can I say something? It's all our fault. Who would keep all this stuff within the reach of 2, toddlers? Yeah. So look at the sparkle in their eyes. They want to be creative. They don't know what else to do. Okay. Some mother has seen the nicer side of it, and then she's posted it on the internet. So I just grabbed that picture just to inform you. You have to be engaging your child or children. Otherwise, this is what we expect. Right. Some of the most common problems people face. I've got about 6, 7 of them. I'll just inform you about what to do with that. Fuzzy eaters. You all think that your child is not eating well, and majority of the times, no one in this world can convince mother and grandmother that the child is well, healthy, eating good. They are never satisfied. I have failed millions of times, and I'm sure I'm going to fail another million of times. I'm not able to convince them that your child is eating well. So it's our thinking as well. Secondly, actually the children can be fuzzy eaters. Sometimes, it's our fault. You keep, the children keep looking at the screen, you keep feeding from the side. What do? They keep there and then they're not even chew. So it's like an exercise without any purpose. Your child should be able to see the food, smell the food, and taste it and appreciate the texture of the food. All this should happen for your digestion to be good. So stop the TV. You might say, oh, it's hard, she will not sit, he will not sit. 2 days he will not sit, 3 days he will not sit. But after that he will. Believe me, this has worked in a lot of instances. And a lot of parents have come back and thanked me. And a lot of times, sitting together as a family and eating also gives a very, very good result. This is more for babies. Parents say, my baby wants to feed all night and I'm not getting any sleep and I've got to work from home in the morning times. So what you can say is, your baby doesn't need food all the night, especially after 2-3 months of age. So it is the habit that we have given them, right? They're not born with this habit. So what you should do after 2-3 months of age, you try and not give any food during the night time, especially the breastfeeding is what I'm meaning here. And they don't need it after 3 months, right? It takes you 3-4 days of difficult times. You feel guilty and all that. Then after that, you'll get over it. And obviously you'll get more sleep. If you get more sleep in the night, you have more energetic and you'll become more productive. On the other hand, your child will also sleep well. There won't be much disturbance during the night. And a lot of people complain, my child is not sleeping well. Single most important factor is the gadget. As I've already suggested, please, no gadgets. Even if you're using it, at least for the last 1 to 2 hours before they sleep, they should not be watching it. And then their adrenaline rush along with the dopamine release will not allow them to sleep. Then there's something called the terrible 2s and troublesome 3s. These are the age group where you cannot do anything. This is where I will say, please go pray God, surrender yourselves, and then pray so that you get less problems from your kids, because this is the age group where they cannot understand anything. But at the same time, we should not stop from making sure that they learn every single step. Okay, this is their very much formative years. People say thumb sucking, don't worry about it. They will not go to their wedding chair sucking thumb, so they will have come out of the habit. Almost everyone. I've not seen anyone sucking their thumb on their marriage hall. So don't worry about it. It just takes a little time. Sometimes it could be anxiety related as well for your children. Make sure those things are all observed and looked at. And again, rewarding is more beneficial here. You just say, if I don't see you thumb sucking for next 10 minutes, you'll get a star. Obviously, 3 stars will give them a reward. So this is how you convert that. Don't keep saying, keep pulling the hand like that. They won't know. Without their knowledge, it just comes back. So instead of that, you go for more positive approach, right? About 2 to 3 years, it will work. People are concerned that the children are touching the genitalia. That's absolutely normal, right? So up to about age of 4 to 5 years, they are exploring themselves. It's called the exploratory phase, and they have to know their body. And they might come up with very funny questions. So good luck answering those questions for you guys. So at the end of the day, touching the genitalia is okay, but make sure again, there is nothing untoward is happening with your child. So you have to be very careful always, especially when you're giving bath or anything, especially for small children. You please have a look, especially if they've got any rash, anything else that is making them go itchy in that area, or they're just exploring. So important for us to be mindful of it, but at the end of the day, don't worry about it. So some of the key elements in parenting, first and foremost, keep calm. If you get frustrated, that is food for your children. They will make you more frustrated. Encourage good behavior. Always do that. We cannot just keep saying no all the time. No, you have to encourage some of the good behaviors that they exhibit. Be positive. See, and then not corona positive, but be positive in life. At the end of the day, if you look at it, these are some unbelievable times, so nobody would have comprehended the scale of the problem that we are having in our hands. So at this point in time, there is no way that we can be negative. So the positive energy should be driven, and that positive energy will be taken up by your child, right? So this is the way that you can help yourself and your family. When all else fails, I told you things can go wrong, it will all fail. We will feel very helpless. We feel like crying, shouting loud. Just go to your balcony, make yourself a cup of coffee or tea. Again, don't look at the media at that point in time. Just relax. Close your eyes, just relax. And gather yourselves again, then come back to reality again. Then you'll be in a much better position to deal with the circumstances. Some of the eating and feeding issues that people ask me, feeding is basically ingestion of the food, right? Eating is obviously, we eat as an individual, we eat. So when you look at it, majority of the times, the smaller the babies are, they're mainly feeding. They keep growing and then they're feeding, and we are also giving them something to eat. Then beyond 3 years, usually they're mainly eating, but with Indian mothers, they are still feeding even at 40, 50 years of age, if their mothers are there. So this doesn't apply to Indian parents. Some of the practical tips that I wanted to give is, for good eating is avoid distraction, especially the TV. It's really bad. Feed to encourage the appetite, set meal and snack times. Only a little bit of water in between. That too I encourage because of summer. It is, sun is, it's very powerful now in May. Therefore, they get dehydrated. Keep them, hydrated. Make sure they're passing at least 5-6 times urine, especially smaller children. So that indicates that the hydration is okay for them. And encourage, don't keep giving. This is one thing that I keep looking at it, and it's a very easy answer for me. Parents come and say, my child is not eating, 3-year-old, 4-year-old. Then I'll ask them, because they're not eating, are you giving a lot of milk? They say yes. If you give milk, it is going to suppress the appetite. A child about 2 years will need only 2 times milk, not like 5-6 times of milk, right? We are very obsessed with the milk. It's not needed, right? Limit the duration of the meals. The meal should not become very stale and tasteless and very, very cold. That should not be it. It should be really hot, steamy, fruits, vegetables, and all those things. You should just try to finish it within 20 to 30 minutes. Okay. So going forward, sometimes systematic introduction of the new food, 10 to 15 tastes, exposed to different ones. If your child doesn't like something, don't banish that food from their table all their lives. After 2 weeks or so, reintroduce that. Reintroduce in a different form. If your child doesn't like that boiled egg, make it scrambled egg, make it, omelette. That way I'm saying. So try and do different things. So a couple more slides to add in. Kids' illness, it's very, very common. We, in our hospital, at least do about 20 consultations per day for COVID, which means COVID is already amongst the children. Although luckily they're not becoming too unwell, but there are issues where post-COVID, a lot of children are developing what is called as the systemic inflammatory disorder. So they, post-COVID, few weeks after COVID, they come up with a lot of rash on the body, rash inside the mouth, and basically they tend to have a lot of fevers and joint pains. These are the things that they're exhibiting nowadays. This is called SIMS C, which is in the children, systemic inflammatory disorder. So this can also affect their heart. I'm not scaring you here, but these are facts. You need to know. You need to know. Better to be equipped with the knowledge rather than not be aware at all. So any child who has had COVID, they've been asymptomatic or mild symptoms, they get better. But after 2 weeks, 3 weeks, if they start developing any of these things, then please do consult your pediatrician. Almost all of us are aware of this, and we are ready to treat these sort of illnesses. We are, in fact, few steps ahead of the illness in those circumstances. But if the numbers become huge, I don't think any system, however good it is, UK failed, Germany failed, Italy failed, America failed. So at the end of the day, none of us can help if the numbers are huge. So for common cold and upper respiratory infection, even COVID behaves in the same way. You keep hydrating your children. Make sure that paracetamol is given, or sometimes antibiotics if it is necessary, only prescribed by your doctors. If you feel like don't want to go to the hospital, a lot of us are doing online consultations. So get on with the online consultation. Just 5-10 minutes. You can explain, we can prescribe, we can do everything on the online platform, and it is quite legal now. Supreme Court themselves have suggested. And there are quite a lot of common cold that comes in, almost 7 to 10 episodes per year. Each one will last 7 to 10 days. This is apart from this COVID I'm talking about. Seasonal flus, dengue, gastroenteritis, these are all very, very common. In fact, we have seen a reduction in all these cases because children have stayed indoors and they've remained healthy, right? But there's a downside to that as well. I am seeing a lot of children who are obese and overweight. That itself is another problem, right? There are vaccines which are available. For example, swine flu. Swine flu vaccine is available. You have to give it to your children less than 5 years of age every year. And elderly people, 60 plus, flu vaccines are available. So that should be given to them, especially if they have comorbid conditions like diabetes, hypertension. They should be administered the flu vaccines. So from the vaccines perspective, we are already doing home vaccination as well. So that needs to be booked through the hospital. We do consultation for it, prescription for it, and then a doctor and a nurse will come to your place and then do the vaccination. So don't deny your children's vaccination just because it's a lockdown. We are not locked down. We are working 24/7, right? So in majority of these cases, doctor's role is less, but more of parental role, especially when you're working from home as well. It is not easy, right? So moving along, how do we prevent the infection? You all know now. Just to dial somebody or one of your friends, and that recorded mission, the recorded message will keep playing. It's quite annoying after some time, but still, it's very important. Clean the hands with soap, sanitizers, use the mask, have the social distancing. The surface also can spread. So make sure your surfaces are clean. Cough etiquette. Don't cough like this because your viruses are on there. So cough like this is what majority of the people suggest. Sometimes if you've gone outside, you inevitably had some contact with people with COVID or suspected COVID, you can come back and then laundry your clothes using hot water. This is what we do after going home. We'll have to put everything in the hot water and then make sure that the infection, we don't carry it home because we've got 2 kids, 2 elderly people. So very, very high risk, but we cannot stop, right? So therefore, if you can stop and stay safe at home, then I think that's the best thing to do. How do you cope these small illnesses? Good old grandma remedies still works, right? Hand hygiene, as I suggested, plenty and plenty of fluids, especially during this summer, they will get dehydrated more often. Okay, paracetamol is one of the safe medicines that can be given. Just one second, Simon, take this call and pass it on to Dr. Deepa. Okay, and steam inhalation, especially if the nose is all bunged up, you can use that. Smaller babies, it's very dangerous to do that open steam, how we used to do in older times. I've had at least 4 children coming up with burns. It just spills somehow or the other. And one baby, unintentionally put its foot inside that hot water with a lot of 3rd-degree burns. So be careful in that. And for cough, a lot of times, honey, ginger, it really works. It's not a grandma medication. It's evidence-based as well. So honey, 1 teaspoon of honey, a little bit of ginger paste, 3 to 4 times a day you give it, and children will take that as well happily. And saline drops to the nose, especially if it's blocked, and more commonly in children less than 3 years of age group, because they're having secretions. They're okay when they're standing. When they're lying down or sleeping, you also put the fan or AC on, and that will dry up the secretions and they struggle to breathe. So steam inhalation is good at that time. Saline drops can also be given to the nose. If there is any genuine breathing difficulty, you need to seek your pediatrician's help. So last slide, but not the least, is the most important thing. The second most important thing, first is staying at home and being safe. Second, as much as possible, please guys, make sure that you get immunized yourselves. Don't fall prey to people saying whether it's Covishield, Covaxin, your Sputnik, I don't care, whatever it is. Okay, Moderna, you want to take whichever one you want, please vaccinate yourself. Elderly people, if you got them at home and not vaccinated, in my opinion, it's as good as committing a crime. Vaccines are there to give you help. And we know from the recent times, majority of the deaths are not happening amongst the doctors and nurses, which happened in the first pandemic. The second wave, because we've all had the vaccines, the infection rates are very less. And also, we should be very happy to know that the people who have died, they're all not vaccinated. I'm not saying happy to know that they're not vaccinated, happy to know that the vaccinated people are not dying in heaps. It's very important. Please do get yourself an appointment and do accordingly how it has to be done. Book yourselves, get yourselves vaccinated. So for your children's point of view, COVID vaccine still not been given to the children, but it's all right. But make sure that they get the other set of vaccines, whatever is due. We don't want, in the middle of COVID pandemic, we don't want an epidemic of a measles or a diphtheria or a polio to spread again amongst the children, because our PICU beds are very small in number. In the whole of Bangalore, we probably have about 300 PICU beds as compared to 10,000, 20,000 adult beds. So now you can do your own calculations. And Bangalore is a watershed area, so it caters to almost 50, 60 districts across 3 to 4 states. So I will leave it to your imagination if children are getting unwell, like how adults are getting unwell. So the take-home message today, friends, please be very safe. Give us less burden. If you are safe, we are not having that much of burden. And at the end of it all, don't be under the impression that children are not going to get it. They are getting it. Luckily, it's mild now, but the third wave is expected to have more kids involved. So please, send this message across and far and wide, but it's not to create a panic. Please understand that. I'm not an NDTV News creating panic here. I'm a doctor telling this is a possibility, very much high on the cards. So spread that information so that our dear and near ones, the kids, are as much safe as possible. With that, thank you very much. I would like to end this session, and I'm very happy to take any questions.
Thank you, Doctor, for the useful session. There are a few questions which has come up. There are always these kids, right? They don't eat the food, or maybe we have made that habit that the kids watch the TV and have food. So people are asking how to make it 0 screen time when they are having the food.
I told you, so I think there is nothing like a science here. We just have to be disciplined. We just say, yeah, screen time is off means screen time is off. When it is off, we cannot sit quietly and keep giving them the food. That cannot happen. Screen is off, you should be on. What it means is do some research every day of the food that you are giving it to your child. For example, today is carrot. You just tell them carrot is very good for your eyes. It's very good for your skin, right? So you teach them about the food that they're eating, about the benefits of that. Keep them engaged that way. Keep telling about the stories. Say, Bhima, how good he was at eating, and what did he made him really strong. So keep it interesting for them. I'm not suggesting put off the TV and you also don't talk. That cannot happen. If you're putting off the TV, you have to switch on, and you have to give understanding the texture. I a lot of times talk about the digestive juices. Why in the saliva, don't just gulp it. Why should you not do? Just like a play you need to do. So I'll just say stomach is the next one where it's going to go. He is your friend. For your friend, you make it easy. You chew it and then send it to him. Make it a nice package for your friend who's your stomach. Something very innovative. It could be just a lot of crap, but you need to be engaging your child, and you will be amazed. You give them 2 minutes of time, 10 minutes they will talk continuously. That's a guarantee from me, right? So they will start asking more and more questions. When they become more and more inquisitive and then ask questions, that means you're winning the battle.
So you have spoken about the hobbies, what can be adopted, but because now online schooling is happening, we cannot avoid the laptop. What else you feel we can do?
Nothing. We cannot avoid the laptop. Therefore, I said you have to use it judicially, according to the age group. I cannot say 4 hours of school, 4 hours of PS4, keep playing, on the games. That cannot happen. If they've done 4 hours of school, they need 4 hours of rest, because the eyes will start, getting the burden, and then obviously they start having the headaches. They will not tell you that the head is hurting. All they do is having a lot of tantrums, right? And more they're watching this gadgets, the less and less sleep they get. If they don't sleep well, they don't grow well. Your brain cells need a lot of rest to accumulate whatever that you've learned. So that way, you have to be strict. When you're saying no, it has to be a firm no. But when you do that, you say no and you go into your room and keep working. That doesn't work. Either you engage them or give them an activity which is interesting for them to do instead of gadget.
Okay. So what are the disadvantages of mask for 2 to 5 years old kids?
See, they need to be breathing really well. They need more oxygen. That is the reason why their breathing rate is about, in a small baby who's just born, is about 50 to 60 per minute. They breathe very fast because the lungs are all small, right? They need more oxygen. Then if you go higher up, 5-year-old will be still breathing at about 30 times per minute, 25 to 30 times per minute. And if you're putting a mask on, then they're not getting that sort of an oxygen. And even for us, the reason I've taken off my mask is I cannot talk. It is difficult. Doctor's job is a lot of talking, apart from looking after the patient, because you have to give reassurance to a lot of people, especially being a pediatrician. So we struggle. So for children less than 5 years, avoid it as much as possible. If they think that they're getting in contact, like some half an hour of play here and there, especially while playing, they should not, and try to maintain the social distance rather than putting on the mask. But if you think you're going to a mall or a marketplace, you have to take your child, let them wear the mask at that time, specifically only during that time, and then come back home and take it off.
And if the mother is breastfeeding, can they get vaccination?
Yes, this is a very interesting question. A lot of debates have happened all over the world. Now the latest guidance is they should get vaccinated. Breastfeeding is not a contraindication for it. Pregnancy maybe, your pregnancy may, what happens is we still don't have the data. Even in lactating mothers, we don't have a data. We don't have like 1 million lactating mothers taking it and no problems. We don't have that. What we have is the knowledge about other vaccines and how they behave. We know knowledge of a lot of different vaccines. So this is also a similarly killed attenuated vaccine, right? So that should not cause any active infection to the mother. On the other hand, whatever that is passed on to the baby through the breast milk can also be the antibodies against the virus, which she has produced it. So please get yourself vaccinated. I'm always advising mothers to go for vaccination even when they're lactating. Please do it.
Currently, because we are not going outdoor and all of that, there will be lack of vitamin D. Should we worry about it?
Yes, we should. We should. All of us should worry. Anyway, vitamin D deficiency is more common in Asian and Afro-Caribbean population. Okay, the slightly darker our skin is, that means more melanin we have got, the pigmentation, then more time is needed to manufacture the vitamin D. So if you're a Caucasian or a white population, you need only 10 minutes of sun. For an Indian or an Afro-Caribbean, we need 1 to 2 hours of sun, for example. So if you're staying at home or Muslims who wear the burqa all the time. So those set of population, again, it's very important to take vitamin D supplements. It's available. It's very freely, easily available. But those who have deficiency, we may have to treat it properly, like giving that sachet of 60,000 units per week for 6 weeks. So that's how we treat it. But for rest of the population, they can take it as supplements. It's available everywhere in the medical store.
Staying at home, wouldn't it make children more prone to virus and bacteria as their immunity doesn't develop? Staying at home and no exposure. No. What we can do for
no. Staying at home gives you more other problems, not the COVID infection. Unless people who are at home have got infection, then obviously you're more prone to get it. Usually when a father or a mother has gotten it, by the time you test, the whole family would have gotten it. Because the symptoms come slightly later than the infection. Okay, you start coughing and having cold and fever today, you'll be infected 2 to 3 days or even 1 week before that. Therefore, you would have infected the full family anyway. So staying indoors, I think, is this what being referred by Mr. Rahul Gandhi? I have a feeling he said something like this. It's utter nonsense. Staying indoors is protective. It comes with its own problems. Like, for example, if you ask me vitamin D deficiency, yes, there are more behavioral problems, yes, more prone. And obesity, yes, more prone. But if you look at it, staying indoors during the lockdown, the number of children getting unwell because of other problems has reduced. Even gastroenteritis is less. Summer, a lot of gastroenteritis happens. So that is less this time. Dengue, last time we didn't even see much dengue in children because they're safe and staying indoors. They're not playing in the parks and getting bitten by these mosquitoes. So it's the opposite. So some of the leaders, we don't have to listen to them.
So some of the kids don't touch the fruits, but they are fine with the juice. Is it okay? It's
absolutely fine, but don't add extra sugar to it. Sugar, again, is termed as the next tobacco in children. So give natural, whatever that they have in the fruit is the natural sugar, which is much easily digestible and absorbable. If you give too much of sugar, a lot of cake, a lot of biscuits, a lot of deep fried items, all it does in a child who is not active will make them obese.
In COVID phase 1, researchers found the fact that standard vaccination like BCG and all at some extent protect COVID infection. Is that true?
Yeah, I think there are a lot of studies which have come that people said Indians are much better in handling COVID because we are all BCG vaccinated. There was some association between measles vaccine as well. All this are now in the past. Now we are in the middle of something where the virus has nicely mutated and it understands in a much easier way how to enter the human cell and how to mutate how to multiply faster, right? It has become clever. So now that theory, we have to leave it in the past. People are dying in heaps. So it is very horrible out there. And, a lot of times we are not able to accommodate for the beds. I have now, after this talk, need to find 3 beds for my, friends, parents, and all that stuff. This is what we keep doing every day in and out. Whether it's 3 o'clock in the night, 3 o'clock in the afternoon, it doesn't stop.
Can we use pulse meter on children? If yes, what is the recommended number?
See, pulse oximeter is fine, but the smaller the children, the less accurate it is. Because you see the pulse ox, it goes and sticks like that, right? So the children's finger, if it's very small, like babies and 1 to 2 years of age group, then it doesn't give you the accurate reading. So you should use pulse ox, especially if you've got COVID positive and you have to keep monitoring your saturation, not just the saturation while you're sitting and watching the TV. You have to walk for 6 minutes. Post 6 minutes, you have to check the saturation. And it should not be less than what you were at rest. If it is less or if it is reducing, every one of us should saturate above 95. If it is less, 92 to 95, you can still manage at home and then wait and watch how things go. If you're coughing excessively, And if your saturations are dropping less than 92, this is when you need to get admitted to the hospital, because you will need oxygen, and in some cases it can be faster spread. You might need NIV form of ventilation also. You will need a lot of IV, antibiotics, also antiviral, and the steroids, and all these things, and plus or minus CT scan. So yes, absolutely. It's difficult to do that saturation with the regular saturation probe in small children. We have in our hospitals different way of doing it, like you like bracelet for the children, and in some places available where for this pulse oximeter you put on the USB stick, and that stick has got the belt. But again, that is very, very small in number. Even it's difficult for us to get it, right? So don't go in looking out for it. It's not available that easily. So in case of doubt, always seek your pediatrician's help.
So nowadays we are seeing that pregnant women is also infected with COVID positive. So once the baby is born, what are some of the precautionary measures which we have to take?
Right. Not some. There are a lot of mothers who are COVID positive, and once the baby is born, it is also more likely to be COVID positive, right? Usually vertical transmission means from inside the mother, inside the baby. That vertical transmission when the baby is inside the mother's tummy is very less or rare. But when the baby comes out, you do the cuddles, you're close to the baby, you're breastfeeding, that is when the chance of getting the infection more, rather than going through the blood of the mother to the blood of the baby, right? So after birth, transmission is the highest. If a baby is needing help, we will keep the baby in the NICU, okay? And we will look after for the symptoms and all that. If the baby is very well, there is no harm in breastfeeding immediately. There is no contraindication. You just need to wash your hands well, wear the mask, wear a gown, and then breastfeed the baby. After that, you give the baby to somebody else to do the burping. Try and be at least 6 feet away from the baby when you're not nursing the baby, right? Your cradle can be 6 feet away in the same room. Or if your room is small and you cannot do things, you can put a screen barrier in between the baby's cradle and you, right? So these are the things that we advise for COVID positive mothers. Yes, we are delivering COVID positive mothers even at motherhood. We have other hospitals also where we deliver them. Sometimes we deliver and then they come in labor, we don't have the results. So we are checking it in all the pregnant women. So we come to know later that she is COVID positive. But we would have taken all the precautions if we don't know the result, or if we know the result, it is positive.
So you mentioned the third wave is coming, and you had given some of the tips as well. Is there anything more we need to be, taking as a precautionary measure?
See, in India, the dictum, prevention is better than cure, holds good, right? For curing, there are only few hospitals for children. You would have gone to Fortis, Apollo, there's that, everywhere you would have gone. But the number of adult bed to children bed, PICU, the ratio is extremely minimal. Therefore, make sure your child doesn't get it, rather than saying, how do I cure it? So the precaution is safe, stay at home, as much as possible, maintain social distancing, as much as possible, you guys get vaccinated when it is available. So these are the things that you can do. And you all, when the lockdown is over, you'll all go outside and then come back home. So take the precautions. You're outside, you also think that it's not just you. If you might be vaccinated, but still you will carry the virus with you. Vaccination doesn't prevent infection. Vaccination prevents you from getting a bad disease because of the infection, right? There's a two different entity. Infection means viruses entering your body. That can happen whether you're vaccinated or not vaccinated. But for you to develop the disease, you're more likely to not develop it in a severe way if you're vaccinated. So don't indulge in a scenario of being unsafe when the lockdown is over, because when you come back, you're exposing your children and the elderly people again.
I know your time is very precious. Last three questions I have. how to identify and prevent happy hypoxia for kids?
Oh, we have not had that so far. It's not that bad in number for children. So happy hypoxia is usually described in the healthy adult population where they have good reserves, and until they reach that threshold, they are okay. They won't even exhibit that symptoms, but they just fall after that because your reserves are all exhausted. So that is happy hypoxia. How do you prevent, or how do you know about it? Is give yourself an exertion. What I told you earlier, 6 minutes of brisk walk is an exertion. Then you test your body whether it is going to be still okay or not. If your saturation is reduced after walking, it should usually be same or higher than what it was. If it is reducing, that is your happy hypoxia. That's when you need to seek help. Plus or minus CT scan, steroids, and all that stuff comes into play at that time.
These are related to kids question. So people do not have more veggies and fruits, and if suppose due to that, if immunity levels are going down for a 2 to 3 years old kid, what will be your suggestion? Whether should we give the supplement, or what is that they can take care at home?
Right. See, up to 5 years of age, you can give the multivitamin supplement. Okay. That doesn't take away from the fact that they should not eat vegetables and fruits. So again, it goes down to the principle of discipline. You all eat at the same time. You are all eating the same one. Definitely today or tomorrow, your child will grab that and eat. Sometimes for children, make it more interesting. It doesn't have to be a raw vegetable. It can be boiled or it can be grilled. Make it in a different way. And as I said, egg, for example, doesn't have to be boiled. It can be scrambled. It can be omelette. So similarly, you have to present it to them in a different way. And at the end of the day, this is the complaint from majority of the people. But if I had known a guaranteed answer, I would have got a Nobel Prize. So it's very difficult. Every child is different. So again, sometimes what happens, reward system helps. You just say, let us all finish these veggies. Then we will all reward ourselves with 1 star. Something like this, come up with a bit more innovation. I don't have a very straightforward answer to this. And why they don't eat, I know. The reason is your junk is much tastier. Your fried items are much tastier, and that is the reason, and maybe the smell, it doesn't emanate much smell. Say, for example, carrot. What smell you have from carrot? Not much. A lot of vegetables don't smell that much, compared to the fruits. So what do? You season it. You make it really bit more, aromatous. Use your innovation. I think Indian cooking is one of the best anyway, and then we've got highest number of varieties compared to all the countries put together. So I think all our mothers can do a lot of innovations in that. So try and do that. I don't have a specific answer for it.
I don't have an oximeter at home. My saturation level, how will I know that it is going down?
You need to buy one. There's no way. If you're COVID positive, that is one of the requisite. If you think you should be looked after at home or home isolation, then you should be ready for it. That means you should have some medications like multivitamins, vitamin C, D. You should have some zinc supplement. You should have access to paracetamol. Then you should also have the pulse oximeter. If you don't have this, then I think you should think of getting admitted to the COVID centers, where even a lot of hospitals have got hotels converted. So that is where you need to go, and then they will be able to monitor you. Okay. If you don't have one, you need to buy one. It might be very expensive nowadays. It's all things have gone up. If you don't have, but if you want to stay at home, I think it's a bit risky. First few days, it's not an issue, but coming to the second phase of the illness, which is from the 5-6 days onwards to the next week, that is when you will definitely need pulse ox if you think that you want to stay back at home.